everyone, this is Suprava. Welcome back to another session with me. In today's session, we will be discussing about Henoch Schonlein Purpura. So Henoch Schonlein Purpura is, it belongs to the group of non-granulomatous and, predominantly small vessel vasculitis. So it majorly affects these small vessels, and also we can see that here there will be non-granulomatous vasculitis. Also, it majorly involves the post-capillary venules. So this is, this is the most common systemic vasculitis which is found in children. It may occur in, it may affect the adults and, young adults, but it is most common in children. So let us learn a bit about the epidemiology of this disease, right? So this occurs worldwide, and if we see the incidence, it is more common in, Asian population, and, if we compare with female children, the male children are more affected, and, typically who are at the age of 3 to 10 years of age, they are mostly, they get mostly affected. And also it is more common during the winter season and also during the spring season. Now this disease presents with a very classic tetrad. Now when we are saying that there is a very classic tetrad, that means there would be 4 classic symptoms or 4 major symptoms which would be present, right, in Henoch Schonlein Purpura. So this classic tetrad is basically, composed of palpable purpura. There will be arthritis or arthralgia, and there will be abdominal pain and renal disease. So you can understand that majorly this disease would affect, or this disease would cause these kind of symptoms. Now when we are saying that it would cause arthritis or arthralgia, then definitely it's going to affect the joints, right? There would be purpura, which is a kind of skin lesions. That means it is also going to affect the skin. Also the child will have abdominal pain, so it affects the abdomen, also the intestine, and it also affects the kidney, and that's the reason the child will have renal disease. Now how these these symptoms, or why this tetrad is present, that we will learn in later slides. So now let us learn about the definition of Henoch Schonlein Purpura. So Henoch Schonlein Purpura is characterized by leukocytoclastic vasculitis and immunoglobulin A deposition in small vessels, right? Now here we got something new, right? That there would be deposition of immunoglobulin A. Now where this deposition would occur, there, small vessels definitely, but small vessels of the skin, joints, GI tract and kidney. So majorly, when we learned about the tetrad, right, the classic tetrad, there also we learned that there would be, the kidney is going to get affected, definitely the abdomen, the intestines, and also, the joints and the skin, right? So that's what we can see in the definition also, that this immunoglobulin A deposition would occur in the small vessels, in skin, joints, GI tract and kidney. But these are, the major parts where the deposition or the accumulation would occur. But apart from that also, there are, there are other organs which might get affected. So this is a kind of disease where, which affects, multi-organ. So it can also affect rarely the lungs and the central nervous system. So it depends upon the severity of the disease, that whether it will affect the lungs or the central nervous system also or not, right? So if we see a child with Henoch Schonlein Purpura, then we can see that, the classic tetrad will be present. That is the palpable purpura, the, arthritis or arthralgia, abdominal pain and renal disease. Well, next let us move on to the pathophysiology of Henoch Schonlein Purpura, right? So we already learned in the definition that there would be deposition of IgA, right? Immunoglobulin A would get deposited in the small vessels, right? So that means, there's somewhere elevated IgA, right? Or there is increased level of immunoglobulin A. So what is this IgA, or where it is found? Now this is a specific antibody which is found on mucosal surfaces. So this is, particularly this is type of antibody which we can find in the mucosal surfaces. So it's found on the GI tract, it's found on the lungs, the respiratory tract, and this is actually this IgA, this antibody is present there because it is a way to prevent the pathogens from trying to enter inside our body through these mucosal surfaces of our body, right? So that means all these, these IgA, this immunoglobulin A, this antibodies are found on the mucosal surfaces, right? And we have these antibodies in our GI tract. We have got it in our lungs, respiratory tract also, right? So this is through this antibody, our body is preventing the pathogens from entering into our body. Well, so this is what IgA does, and this is where IgA can be found. Right. Now coming to Henoch Schonlein Purpura. Right. So in Henoch Schonlein Purpura, we know that there is elevated level of IgA. Right. And that's the reason it's getting deposited. Right. There is deposition of IgA in the small vessels. Right. Also, this disease is associated with respiratory infection. This is not, all the time we cannot see that it is associated with respiratory infection, but there is some association, it is believed. So, some sort of pathogens, when they get into the respiratory tract and they cause an infection. So, when there is infection in the respiratory tract, right, in the upper respiratory tract, and it could be trachea, it could be our mouth, throat, right? So when there is infection in the upper respiratory tract, what happens? These IgAs which are present on the mucosal surface are being released, right? Because the main purpose of this IgAs or these antibodies is to fight with the infection, right? So when there is an infection in the upper respiratory tract, what would happen? These IgAs which are present on the mucosal surface of the respiratory tract would be released to combat with the infection. So this is what happens when there is an upper respiratory tract infection. So here, the pathogens which are actually infecting the respiratory tract, or which is attacking the respiratory tract and causing an infection, are quite similar to the wall of our blood vessels, right? So we have our blood vessels, and then these pathogens which has entered the body are quite, similar, right? So this similarity is actually called as molecular mimicry. So now imagine these antibodies which are being released from the respiratory tract to fight with the infection, right? Those antibodies actually would find this blood vessel, the wall of the blood vessel, also very similar with the pathogen, right? So when it is attaching with or attacking the pathogens, at the same time, this wall of the blood vessels is also similar to the pathogen, right? So what would happen? Accidentally, these antibodies, these IgAs, would also get attached with the blood vessel, and this would lead to formation of immune complex. So we learned in the definition that there would be deposition of IgA antibodies, right, in the small blood vessels, and that is what is actually this deposition of immune complex. So the immune complex has been formed already. Now this immune complex would get deposited in the small blood vessels. Now we have got small blood vessels, or several small blood vessels in our body, right? So if this immune complex would get deposited in the small blood vessel of our skin, then that would cause purpura, a palpable purpura. And if it gets stuck in the gut, then it would cause mesenteric vasculitis, and that would lead to severe abdominal pain. So you can understand that how this tetrad, the classic tetrad, is caused actually, right? So here, if this immune complex is actually traveling down to the kidney and it's getting stuck there, then definitely there would be nephritis, there would be renal disease, right? Renal damage will be there. And also if when this immune complex would travel down to the joints and it would get stuck there, that would cause arthritis or arthralgia. So I hope you have understood that how this classic tetrad or classic tetrad symptoms, which is a very unique feature of Henoch Schonlein Purpura, is actually caused. Now next, let us move on to the clinical manifestations of Henoch Schonlein Purpura. So in clinical manifestations, the first thing that is very evident in this disease is palpable purpura, which comes under this classic tetrad, right? Now this is one of the most classic symptoms of Henoch Schonlein Purpura, and we can find these purpura or these rashes most commonly in buttocks, but also in the legs. Now, why it is palpable? We're saying palpable means if you run your finger through the skin, you can feel it, right? So there you can feel a bump on the skin, right? So why this is a palpable purpura, right? So palpable because there would be swelling. Now why the swelling? Because there is immune complex deposition and that would cause this swelling. So because of this swelling, the purpura would be palpable. So this is a very unique feature of Henoch Schonlein Purpura. Next, there will be arthralgia, which we already learned that when this immune complex would travel down to the joints and it would get stuck there, it would get accumulated there, then it would cause arthralgia or arthritis, right? Also, the child will have abdominal pain because again it can cause mesenteric vasculitis, right? So if it is getting stuck in the gut, then again the child will have abdominal pain. Also, that would cause bloody diarrhea. This is also very common in Henoch Schonlein Purpura. Apart from bloody diarrhea, the child will have melena, which means dark stools. Also, there will be hematochezia. Hematochezia means there would be bright red blood in the stools, right? So all these things would be caused because this immune complex is getting stuck somewhere, right? It's getting stuck in the small vessels. So there is deposition of this immune complex in the small blood vessel, and that is the reason it is causing this vasculitis, and because of that there will be these symptoms. So if it when it would affect the kidneys, definitely it would affect the small blood vessels of the kidneys, and that's the reason the child will have hematuria also. And along with that, definitely if it affects the kidney, there would be renal damage. Well, next let us move on to the management of Henoch Schonlein Purpura, right? So in management, mostly we don't have a specific treatment for Henoch Schonlein Purpura. So mostly what we do would be symptomatic therapy, right? So whatever symptoms would be there, we would just we have to manage the symptoms, right? A kind of supportive therapy we would give. So in our symptomatic therapy, there would be NSAIDs, so non-steroidal anti-inflammatory drugs would be used, and this would actually this would reduce the arthritis or arthralgia. So we already know that the child will have severe joint pain, and the pain will be actually very severe. So to control that, we can give NSAIDs. Next, we can also give early glucocorticosteroid treatments. Right now, this is very helpful in reducing the abdominal pain. So the abdominal pain is actually also very severe. The child will be crying out of pain. So to reduce that, to alleviate that pain, we can give glucocorticosteroid treatment. But this is used when there is persistent nephrotic syndrome, or there is crescent in more than 50% of glomeruli, or the child has severe abdominal pain, and there is substantial GI hemorrhage, or if there is intrapulmonary hemorrhage. So all if any of these symptoms are present, if it's a kind of it's very severe, then in that case we would give glucose corticosteroids treatment. Now, other than these, we would also give steroids. So why, how the steroids would help? The steroids would actually inhibit the immune system from causing further damage to the blood vessels, right? So here we can see that it's a kind of autoimmune, disease where our own antibody is actually causing the problem, right? So we have to stop the ongoing damage which is going on, right? The ongoing damage of the blood vessels. So for that, we can give steroids that would inhibit the immune system, right? So that would inhibit the action of our immune system. Well, next let us move on to the nursing management. So in nursing management, first we would do nursing assessment, right? And while doing our assessment, what are the things that we would check, right? So when a child comes with all these symptoms with of Henoch Schonlein Purpura, that means the child will have rashes or purpura all over the body, right? So we have to first assess these purpura, and while assessing these, we have to check what kind of purpura it is, because in Henoch Schonlein Purpura, it would be a palpable purpura, right? So we already learned that because of the swelling which is present, the inflammation, because of that there would be, that is a palpable purpura, right? So while assessing these purpuras or the rashes, you have to make sure that you understand what kind of purpura it is, right? So that is the first thing. Next would be assessing that which are the areas where majorly it is present, right? So we know mostly it would be present in the buttocks, and then also it involves the legs. Well, after that, we also have to check if the child is having, this classic tetrad symptoms, right? So if there is presence of abdominal pain, or, joint pain, and, some kind of renal involvement is also there, right? The child will have hematuria, or, renal damage, right? So these things we have to assess at the first place, right? Now, after assessment, we would go for the diagnosis, right? So in nursing diagnosis, what is the first thing that you think would be present, right? Now, majorly we when we discussed about the clinical manifestations, I told you that the child will have abdominal pain, joint pain, right? And I mentioned that this pain will be severe, right? The child will be crying out of pain. So there would be acute pain related to inflammation of the small blood vessels. Also, there is this purpura is present all over the body, right? So there would be impaired skin integrity related to this rashes. Also, the child will have risk for infection related to impaired immune reaction, because we know here it's kind of an autoimmune disease where our own antibodies are actually causing the problem, right? So definitely there would be some sort of risk for infection also which would be involved. Well, so these were some of the nursing diagnosis. Now next let us move on to the nursing interventions or nurse's role in managing Henoch Schonlein Purpura, right? So first thing would be, as a nurse, it's our responsibility to assess it, right? So if we can assess and if we can diagnose it, at the earliest, then we can treat it, or treatment would be, would be very progressive, right? So first thing would be assessing this, the signs and symptoms, assessing the child properly, right? Well, so next will be maintaining the hydration. So there should be adequate hydration, because already we know that this immune complexes of IgAs it's getting deposited in the blood vessels, right? And that's the reason we have to make sure that the child is drinking enough fluid, drinking enough water, right? So we have to maintain an adequate hydration, and then we have to advise the child to take enough rest, right? So that is very important, because the child is having joint pain and abdominal pain, and these pains would be severe. So we have to make sure that the child is taking enough rest. Also, you have to advise the parents that they make sure that the child is taking enough rest. Next, if the child is on any antigenic stimulants, or any sort of drugs, immediately we have to stop, or we have to discontinue that drug, or discontinue that exposure to antigenic stimulants. Next, we have to monitor the child continuously. So, any child who is diagnosed with HSP, that is, Henoch Schonlein Purpura, we have to, make sure that we check the blood test and the urine test for at least up to 6 months after the diagnosis have been made. Next would be, we have to educate the parents about the disease condition. So as a nurse, it's your responsibility to make the parents understand that this is not a contagious disease, right? So if the child wants to go to school, once the symptoms subside, that is a fever and the rashes and the pain, so if these symptoms subsides, the child can go to school, because it's not contagious. Next, you have to advise the parents if the child develops a very severe abdominal pain, and this is after after the treatment. If suddenly the child develops severe abdominal pain, or if they find out that there is blood in the stool, or there's significant joint pain, and the child is urinating less, so these are the signs and symptoms, so which indicates that the child has not recovered completely, right? So you have to advise the parents that if they find out any sort of symptoms like this, they have to inform the physician. Next, we have to ensure that the child is taking adequate nutrition, right? So there should be a healthy diet. Also, we have to make sure that the child is taking all the prescribed drugs, and there is regular follow-up. So if there is no significant renal involvement, and if we find out that there is normal urine analysis at 12 months, then after that no further follow-up is required. So these were some of the nursing interventions, or nurse's role in taking care of a child with Henoch Schonlein Purpura. Well, that's all about today's class. So let us conclude our today's topic here. So today we learned about Henoch Schonlein Purpura, which is actually, in which we can see that there would be classic tetrad signs. In that we can see that there would be palpable purpura, there would be abdominal pain, joint pain, and also there would be renal disease, right? And in this, all these things are happening because there is deposition of IgA antibodies in the small blood vessels, right? So we learned about this condition, and we also learned that how we can manage this, right? So I hope you have got a better insight about the topic. Thank you.